Hello, I'm Patricia Henderson with Senior Connection Center, and this is your weekly connection. September 22nd is the first day of fall. For many, that means pumpkin spice lattes, changing colors on the trees, and a little cooler weather. But it is also Falls Prevention Awareness Day, and September 20th to 24th is National Falls Prevention Awareness Week. Are falls really that big of a problem? Well, we're going to learn more today, and here today to help us learn are Carina Shrestha, Health and Wellness Coordinator at Senior Connection Center, and Tasha Saca, Manager of Wellness and Strategic Partnerships at Reliance Medical Centers, and she is also the chair of the Fall Prevention Task Force of the Polk County Coalition on Injury Prevention. Thank you both for being here today.
Thank you, Patricia, for having us here, and glad to be here.
Thank you.
Tasha, will you tell us a little about the Coalition on Injury Prevention?
Thank you. Yes, I'd love to. So the Coalition on Injury Prevention has 3 different task forces under it. Falls prevention, which is the one that I'm the chair of. We have drowning prevention and bike safety and pedestrian safety. So basically, the group as a whole is a networking group that provides injury prevention resources to positively impact communities through partnerships, communication, and supportive community events. One thing that we really love to do is receive and disseminate valuable information to partners or anybody looking for it. We just want to bring that awareness up.
Carina, why is there so much concern about falls? Is this really a big problem?
Yes, it is. It's a big problem. Falls continue to be national public health concern. Many people think falls are a normal part of aging, but the truth is they are not. Most falls can be prevented, and you have the power to reduce your risks, exercising, managing medications, having regular or at least an annual vision and hearing checked, and making the living environment safer are all steps that you can take to prevent fall. And talking about stats, falls are the leading cause of fatal and non-fatal injuries for older Americans. 1 in 4 older adults fall each year, and more to that, every 11 seconds, an older adult is treated in emergency room for a fall. Every 19 minutes, an older adult dies from a fall. Falls can cause serious injuries. Falls results in injuries such as hip fractures, the most common one, broken bones, and head injuries. In fact, more than 2.8 million older adults are treated in emergency departments annually because of fall, resulting over 800,000 hospitalizations. Falls are costly, and I bet Tasha would agree with that.
Tasha, are there other reasons fall prevention is so important?
Absolutely. So as you know, most falls are preventable. And with the average hospital cost for a fall injury being over $30,000, falls with or without injury can carry a really heavy burden on your quality of life. After a fall, a lot of people develop a fear of falling, and as a result, limit their activities and social engagements. Fear of falling can result in further physical decline, depression, social isolation, and feelings of helplessness. If you have an aging parent, grandparent, or an older adult in your life, help them stay healthy and independent for as long as possible. And that's how you can do it, by preventing falls.
Carina, what are some of the risk factors for falling?
Many things can cause fall: your eyesight, your hearing, and reflexes. It might not be as sharp as they were when you were younger, right? Diabetes, heart disease, or problems with your thyroid nerves, speed, or blood vessels can affect your balance. Some medicines can cause you dizziness or sleepy, making you more likely to fall. Other causes include like safety hazards in your home or in your environment itself. Yes.
Tasha, what are some ways to prevent falls?
There are many ways to prevent falls, just kind of piggybacking on what Carina said. So if vision and hearing is something that contributes to falls, then getting that checked out with your doctor is really important, making sure you do that every year. Regular exercise. So some people think the lack of movement is what you need to do to prevent falls, but we know that is not true. Getting a medication review, as Carina said, there's a lot of medications that can contribute to falls. So definitely getting that reviewed by your pharmacist and your primary care provider is a great way to start. Getting your annual wellness exam, that way, you know, it's a really comprehensive way to check on everything. Your footwear, that is something that people may not think about, but you know, if you have a flip-flop and it's raining, the odds of falling are going to be pretty high for anybody. Just kind of slowing down, being aware of your surroundings, transitioning from seated positions to standing slowly, especially if you have some blood pressure issues. That can be a great way to prevent falls. Evaluating your environment. So there are a lot of professionals in our industry that can do these home assessments. There's resources available on the National Council on Aging as well. So there's a great fall risk evaluation tool there for the home.
That's great information. And we will have the website for the National Council on Aging at the end of the video. Carina, are there ways people can improve their balance?
Definitely. There are many ways to improve your balance, your strength, and prevent from falling. When you go to your doctor next time, like when you make your appointment, ask for an assessment of your risk of falling, share your history of recent falls, regularly review, like Tasha said, regularly review your medication, both prescribed and over the counter. Talk, hear about side effects. Does it encounter with like dizziness, sleepiness, things like that? Again, like Tasha said, be aware of your environment, both inside your house and outside, right? Get your house well light up, your living space. Yep, and then also stay physically active. Find a good balance and strength exercises program in your community. Call your area agency of aging and ask for referrals. Talk to them if they have any kind of health and wellness programs. And most of the time, these health and wellness programs are free of cost. And we have in our agency, Senior Connection Center, we have wonderful fall prevention programs that are free to our seniors. And they are Matter of Balance, Bingo Size, Tai Chi for arthritis. These are great programs.
How can someone find out about the current classes through Senior Connection Center?
Yes. So for the current classes schedule, you want to visit our website, seniorconnectioncenter.org, or we regularly post our flyers on our Facebook page, Senior Connection Center's Facebook page. Yes.
And we will have those links for you as well at the end of the video. Such great information today. Carina and Tasha, thank you both for being here.
It was a pleasure. Thank you.
Same here. Pleasure to be here.
Falling is not a normal part of aging, and most falls are preventable. Check out our website for current classes to improve your balance, and check out the National Council on Aging website for information on assessing your home for fall risk. I'm Patricia Henderson, and this is your Weekly Connection.